the talk for this afternoon is really, it says Fight Club dengue versus chikungunya. But actually, the talk is mainly on chikungunya, but we'll be comparing it with dengue because these two viruses actually share similar clinical features. So we'll try to identify and see which are the more prominent symptoms that may be associated with chikungunya that can differentiate it from dengue. Okay. Next. Ako ba magpipindot? Which one? Ito. Next. Okay. Okay. Now, arthropod-borne viruses, the so-called arboviruses, are actually the causative agents of some of the most important emerging infectious diseases, and have in fact become a substantial public health problem. Two of these viruses, dengue and chikungunya, are actually often mistaken for each other or confused because they share similar clinical features, they share the same vector mosquito, and in fact, these two viruses can co-circulate and lead to dual infections and, of course, concurrent epidemics. Okay. After several decades of absence, chikungunya has now again re-emerged in both Africa and Asia and has caused large outbreaks and is now becoming a significant public health problem. As we know, last year, sometime in July and August, we've seen a lot of news about chikungunya being identified, or that the Department of Health declaring several areas of the country as having outbreaks of chikungunya. For dengue, well, it's not a problem. It's always been there. You know, we've always heard news almost for the last so many years that there's this problem about dengue. It's increasing, or maybe cases are actually the same as that of last year, as much, so many, etc. It was only last year when, in the Philippines, there was really this outbreak that the Department of Health has become concerned and has been reported in newspapers. So the objective of this talk is really to differentiate chikungunya from dengue based on the epidemiology, the etiology, clinical features, laboratory features as well, diagnosis, prevention, and prognosis, and to come up with a short summary of the most important prominent features that may actually differentiate chikungunya from dengue. Okay. So, chikungunya was recognized as a human pathogen, in Tanzania in the 1790, when the virus was actually isolated from the serum of a patient presenting with acute fever in Tanzania in 1953. And since then, there have been outbreaks. Dengue, on the other hand, was first recognized as a human pathogen by Benjamin Rush in the 1700s as well. And in fact, they believe that epidemics may actually have occurred as early as the 18th to the 20th century. And in Australia, sometime in 1700s as well, or 1897, they noted hemorrhagic manifestations such as death, shock. And in fact, this hemorrhagic phenomenon persisted up to about 15 years in Australia. And the same hemorrhagic phenomenon was identified in Greece in 1928 and in Taiwan in 1931. It was only in 1954 when the so-called new syndrome of hemorrhagic manifestations was identified in the Philippines. As far as chikungunya is concerned, the 1960s to 1970s, there were several outbreaks that have actually occurred in Eastern and Central Africa as well as in Western Africa. And in the 2000, from 1990s to 2003, several have been identified outbreaks and epidemics were identified in Indonesia, Myanmar, Vietnam, Thailand, etc. Some believe that chikungunya may have actually started sometime the same as that of dengue. However, the first reported outbreak of chikungunya was in 1967. And since then, numerous outbreaks have actually occurred in Africa and even in Asia. Okay. As you can see, if you look at the global distribution of chikungunya and dengue, they're very similar. They have the same mosquito vector, therefore you would expect that they would probably have the same distribution. If you look at this slide, that for dengue, the blue circles actually indicate the historical distribution of dengue in countries where the virus was identified by either virus isolation or by serology. The red circles, anyway, the red circles, I hope you can see it. It's very glaring, really. The red circles actually indicate